Do you struggle with type 2 diabetes because you lack discipline? I don't think that's probably the reason. Even if you do lack willpower or discipline, it's probably not the reason why you struggle with type 2 diabetes. It's probably more likely that you either get confusing advice from online or from other people, or you just don't know how to get started, or you're too concerned about getting started and changing your lifestyle right now, and you figure that since you don't have a lot of symptoms, you can just wait. Well, these are all not such great ideas. Why aren't they great ideas? Well, first of all, the longer you wait to get started, the harder it is to maintain management of your type 2 diabetes. Beta cells, for example, are such a significant factor. Beta cells are the cells that manufacture and develop insulin. The longer your blood sugar is too high, the harder it is for your beta cells to be effective and work. So it's harder for you to manufacture and develop insulin. Since I've had type 2 diabetes for 40 years, and I didn't know what I was doing when I first started, my beta cells don't function as well as they do, but actually they function much better now than they did 20 or 30 years ago. And I've had type 2 diabetes for almost 40 years, and my beta cells function better now. And I actually control my type 2 diabetes better now. And yes, I do take meds. Doesn't mean that you have to take meds. So what are some of the reasons why, what are some of the myths that affect you, that cause you not to be able to maintain management of your type 2 diabetes? One is, you think you have to cut out carbs. Well, cutting out some carbs is good, but cutting out all carbs, it's probably not something you want to do for the rest of your life. It's probably not something you can do for the rest of your life. Do you like pasta? Do you like dessert? Do you like eating things that aren't perfect for you? I do, and sometimes I eat them, but I do eat them less now than I did over the 30 or 40 years that I didn't control my type 2 diabetes. I've had absolute or very good control over it for the last 5, 6, 7 years. I actually maintain a level between 70 and 180 in my blood sugar, probably 80 to 85% of the time, which is higher than the average person does. And you can do the same thing. And through this process, I'm going to show you how. So cutting carbs is something that you want to do a little bit, but it's not the whole story. Insulin resistance is a problem, and you need to minimize insulin resistance so that you can maintain control of your insulin, and you can manufacture insulin, and you can have enough insulin to maintain a healthy level of insulin in your system. Developing muscle is important. I do muscle work every day. And I've shown you in the past, and I'll show you in the future, the different types of muscle work you have. And if you want to know more about muscle work, I'm more than happy to show it to you. Timing of how you eat is so important. Walking and getting a little bit of exercise is very critical. You don't need to be obsessive about getting exercise. You don't need to be a weightlifter, but you need to move, and you need to do some muscle work. And these are important factors, and I can show you how to do that. Another myth is weight. A lot of people think that you need to lose weight in order to maintain control of and manage your types of diabetes. Should you lose weight, and will weight help you reduce your insulin resistance? And will you be able to lower your A1C if you lose weight? Absolutely. But it's not the only thing, and there's so many things you can do while you're losing weight. So I don't want you to think that you're not going to be able to maintain management of your type 2 diabetes until you lose your 30 pounds, or you're 40 pounds, or you're 20 pounds. It's not easy to do that, and sometimes it's not consistent. Not only that, but sometimes it comes back. It's what we call, people talk about reversing diabetes, and people think that if they lose weight and if they cut out carbs, they can reverse type 2 diabetes. Reversing is a myth, frankly. It's rare that someone actually reverses diabetes. Endocrinologists and doctors call it remission. And the reason they call it remission is because in reality, you have to actually maintain high standards of health in order to maintain your level of insulin resistance and keep your insulin at a healthy level and keep your A1C at a healthy level. Otherwise, you revert back to unhealthy level of type 2 diabetes. So that's an important factor. I want you to ignore the word reversal and remember that you want to get in remission. And if you can get type 2 diabetes in remission for a long time, that would be incredible. I've done it, but I take medication. That's the third thing I want to talk to you about, another myth. People think that medication is failure. Actually, these days, with the modern meds for type 2 diabetes, they're rather remarkable and they're really healthy. In the old days, you would run the risk of taking some meds and your blood sugar may go too low. Now the meds that they have help you lose weight, and they help you lower your A1C and lower your blood sugar without going low. These are rather remarkable things. Other things that meds do is they help you avoid kidney and heart disease. So if you need to take meds, and most people who have type 2 diabetes will eventually need to take meds, and I want to encourage you not to avoid meds because you think you are failing if you take meds. So I want you to subscribe to this video. If this makes any sense to you, right below, subscribe. What that will do is you'll be able to get videos of mine regularly and consistently. And I post them regularly, both to help you understand how to maintain management of your type of diabetes, and also to remind you each and every day that you need to keep on it all the time. Doesn't mean that you can't go splurge a little bit and eat something unhealthy. I do it all the time. Yesterday I had some ice cream. But I also have a healthy blood sugar, a healthy A1C, and I keep my blood sugar under control most of the time. So I want you to subscribe below. And also, if any of this makes sense, we have a free guide called the Type 2 Pivot Method, and I encourage you to check it out in my bio, and have a great day. Bye.